Here is a story that the left will print, but not really focus on for very long. Great Britain's government healthcare system is falling apart. Now, that's not a conservative talking point. That is from the New York Times when they reported on it. The headline was British National Health Service in Crisis. The head of Britain's National Health Service warned that the system is overwhelmed. What a surprise. Who could have seen this coming? Last year, he requested £4 billion in additional funding. He only got $1.6 billion. He also oversaw a time where 10,000 nurses quit. Now, the crazy thing about the New York Times report is that all of the things that conservatives criticize about socialized medicine, all of the reasons we say it's a bad idea, it's unsustainable, it will not work, are actually happening. And here's the crazier part. The New York Times wrote about it. It's the kind of worst-case scenario stuff that the left makes fun of the right for talking about. For example, quote, hospital hallways jammed with beds of frail and elderly patients waiting to be admitted. Outpatient appointments canceled because there aren't enough doctors to meet demand. Patients waiting over 12 hours in emergency rooms before receiving care. Undergraduate medical students being asked to volunteer to help ease the crush of patients. 2 weeks ago, hospitals were ordered to postpone all non-urgent surgeries until the end of the month. Many British hospitals are also declared black alerts, meaning they cannot meet patient demand. On Twitter, British doctors described their overcrowded hospitals as third world conditions, forcing them to practice battlefield medicine. The NHS director warned that the patient waiting list will grow to 5 million people by 2021. That's the highest number ever. If this were not in the New York Times, no one on the left would believe it. You wouldn't believe it if I said it. In fact, I have said it was coming for a long time. A British construction worker learned the news from the latest rounds of thousands of postponed surgeries. He said, if I receive a notification, it'll be the third time my operation is postponed. This is a disgrace. We injure ourselves while working to pay our taxes, and the government just leaves us to suffer. Are you listening, America? Are you really listening? If you are still interested in that Bernie Sanders government health care plan, maybe you need a lesson in critical thinking.